Okay, so health promoting church is a model for effective and sustainable health promotion ministries. I will go back a little bit to 1964, where the little more documentation of the work of WCC on health and the consultation 1964 actually there was that affirmation: the Christian ministry of healing belongs primarily to the congregation as a whole, and only in that context to those who are specially trained, nurses, doctors, pharmacists, dentists, and all that, those who we know as health professionals. And there was also this observation: the medical institution and the church on the national and more particularly on the local level have traveled too often in separate directions. So even where you have a church and a church hospital in the same geographical location, you see that there isn't much interaction. And the medical ministry, the health ministry of the church, exemplified in the hospital, may not necessarily be part of the life and witness of the local church. These observations in 1964, I think they still remain now in many parts of the world. We still having challenges of bringing the healing ministry into the congregation, even where we have robust health ministries going on in health facilities. More recently, in the mission statement Together Towards Life, we say that actually healing was a central feature of Jesus's ministry and central also to his core, to his followers. Most of the miracles that Jesus performed, they were pertaining to health and healing. And health is more than physical or mental well-being. Health is not primarily medical. Yes, medicine is a very important part of the whole health spectrum. It is the most professionalized. It is the most visible part of health. It is the most expensive. It is many times the most dramatic. But health is beyond medicine. Health is a matter of justice, peace. It's a spiritual issue. We have to take personal responsibility, but also there's community and the systems. This could be political system, the socio-economic system. All these, they shape health. And for churches, we asked a short question a few years ago: do you have a Christian health association in your country? And so out of a number which responded, I got 15 said, yes, we have a Christian health association. Most of these are in Africa. There's also India, Bangladesh, and the UK that answered yes. And out of the 17, there was 1,463 hospitals, 2,000 health centers, and 483 training institutions. So churches are strong on health as far as facility-based healthcare is concerned. And the need is there. The 2019 global causes of disease, the top 10: ischemic heart diseases, stroke, obstructive pulmonary diseases, cancer, and all that, diabetes mellitus, kidney diseases. 7 out of these 10 are non-communicable, that are related to lifestyle, food, diet, living conditions, and all that. In other parts of the world, you actually see that road injuries also feature among the top 10. Road injuries and tuberculosis. Need is huge. Why do we bring churches into health? When we compare curative services, hospital-based health services versus health promotion, you see that actually, even if curative services may be easily responding to felt need and able to attract financing, has good visibility. They are not very good at disease eradication. And disease eradication, it requires community involvement and community-based activities. And as in the Ottawa Charter said, health is made or broken, not in the hospital, but in the community. So churches are better placed with viable community resources, religious ideas, practices, and experiences, but also systems and structures that can promote, that may be deployed to health promotion. People are dying from diseases that are preventable. And so by having robust health promotion, it is actually prevention becoming a tool for healing. So now in this health promoting churches model, we are looking at the first one, which we published, is reflections on health days. So these provide an easy starting point to engage churches on health matters. Church groups and church retreats, basic reflections providing medical information, key priorities or bottlenecks on particular health issues. These are commemorative World Health Days anyway. We are all aware of, for example, World AIDS Day. Okay, so they would easily provide entry point to partner with government institutions, because most of these health days, they will be already national level, local level health mobilization. So a local church can easily plug into these systems to actually have health promotion activities in the congregation. Then we have a handbook, which provides a program approach to health with checks and checklists and templates to help churches establish and run sustainable health promotion ministries. And there are three key points, key areas I would highlight. At the center is a church health committee that will be on the driving seat, managing and leading and motivating and guiding and planning congregation health activities. The second are that the main interventions which we are proposing are four interventions. Number one, health education. The churches would be centers where viable, reliable health messaging would be provided. And the second are practical things that we can do together, and then advocacy, and also empowerment for public witness, because everybody has to be salt and light in their scope of influence. What can they do? The third center I could highlight is that a church shouldn't try to do everything. Okay, so start small, basic package of activities, and then grow to intermediate and advanced. So the four areas of intervention, you start small, start basic health education, basic practical activities, and then move to intermediate or advanced, even when you can mentor other churches. Then the third one are contextual Bible studies on health and healing. These employ the CBS methodology to help churches navigate, he was saying, more difficult health issues, where you need much more time to interrogate the context, the contextual realities, and also to see what scripture says in those specific health issues. It uses the See, Judge, Act methodology. And we started this publication. There are 27 very exciting Bible studies. So I will summarize that health and healing are central to mission. They are not an add-on to what churches can do or should do. They are central to the very existence of churches. The Christian ministry of healing belongs to the whole congregation and not only to health professionals. We need a healthy balance between health promotion and disease prevention. And churches are well placed to implement health promotion initiatives because they are rooted in the community. And we have these tools that are there to accompany churches to start and run, implement viable health promotion ministries. They are available for free download on the WCC website. Thank you very much. I will stop my slides there.
in terms of the medical, as 1964 is said, medical institution and the church were going in different directions. Uh, now, now we have realized that health ministry and church ministry need to be brought together and they need to be overlapping. So we have realized that health is multidimensional and it involves so much of issues like it's not only physical well-being. The physical well-being is there. Even in that, under physical well-being, there is the aspect of justice, peace, and it is in terms of bringing about through the different structures. So as Moise pointed out, that 70% of the deaths that are happening are non-communicable. So I was wondering, if that is so, how much it is related to the things that can be avoided, and as we had rightly said, things that can be stopped or things that can be intervened. Uh, and so the need for church to intervene in such situation to stop or to promote health and to promote care. So it's mainly this lifestyle, the 70% deaths, if it is non-communicable or it's not genetically transferred, then it is primarily because of the lifestyle problems. So church need to intervene in that issue as well. How do our daily living reflect this holistic aspect of health? Then in terms of, as he said, see, judge, and act, in terms of these three things, I see the aspect of justice where well-being, a simple well-being is denied to a major chunk of people. And this is related to the second aspect, second part of the paper where poverty is related. Health is denied to a majority section. And so since the primary physical health is denied, people are denied access to further development and and so it perpetuates. And so the aspect of justice, where opportunities are denied, where infrastructure is denied, where services are denied, and when all these services are denied, the whole health is affected. So Medicare, that is one aspect. And another aspect that I draw from this, that I would like to post question to Moy is about the medical ethics, that we see that even as the physical health is being taken care, we see that when one aspect is treated or is cured, another part of the organ is affected. So when one thing is cured, it tends to bring disorder to another organ. If heart is taken care of, then kidney will be affected. So in that sense, medical ethics, I mean, how, so I see we need to have a balance on that, or the church need to draw attention to it. So in what way we can, this intertwining of healthcare and the church coming together, provide this holistic health to all. One in terms of the justice to all, and another in terms of the ethics. This is same in where we have understood that when individual is taken care of, the community is lost. The communitarian vision is lost. So that aspect, both can be combined. Even medically also, when a particular organ is treated, another organ is affected. Similarly, we understand our traditional theological understanding also, when one aspect, I am a God, that individual aspect is stressed, I lose my communitarian vision. So this, I see a link, and there the church and health, the health ministry, we can have it together.